Hello, everyone, and welcome to this audio podcast. This audio podcast is part of a Segmental Scruples edition or series. This audio podcast is part of a Rampage Sonar. This audio podcast as part of a Blitz Lobostics. This audio podcast as part of a Storm Lobostics production. This audio podcast a little bit around the sort of overall sort of conclusions around this sort of works. So scientists or healthcare scientists should not set themselves away from passing on important understanding of care that might also have an impact on clinical or sort of scientific sort of clinical or scientific sort of pathways. In this regard, if transfusion services are to be effective, scientists need to ensure safe and quality assured practices. And there is an interaction or interplay between healthcare sort of in between sort of sectors, but at the same time, at every level, allowing all to prompt issues when and if required. Having transparency in around terminology is also important because this has an impact on knowing the intricacies of renal disease or renal failure more generally. So at the same time, there was a Institute of Biomedical Sciences sort of a benchmark series which outlined several main themes for scientists in senior positions who look to integrate knowledge or understanding with everyday or routine practices. So reflection is paramount to help bridge gaps and integrate renal health and sort of tightening the research in the future care of patients or recipients with a long-standing condition and or chronic illnesses. So an overall basis around this works in regard to sort of the main questions and some contemplations, and where sort of the main questions, main points and sort of contemplations are linked to three different aspects. Number one, what is known about the topic, what is new. Number two, what is new, and number three, what are the main sort of questions for in around prospective works in around this entity or in around this element. So in around what is known about the subject, number one, there is still a need to consider or requirement to consider renal health in amongst transfusion care and sort of practices to ensure effective and best practices are achieved across healthcare spheres for patients with long-standing conditions or chronic illnesses, and the complexity of care plans should highlight the importance of better integration across laboratory practices, and medicine in order to achieve formal consensus and help form guidelines. In around what is new. So whilst this work had uncovered sort of four main themes, it is evident that there is no universally accepted framework or guideline to inform what is best transfusion practice in the care and treatment for patients with a long-term condition, and/or chronic illness. And in around sort of the one of the prospect one of the sort of sort of questions for in around future prospective works in around this. So there is no sort of framework or guideline of, for example, when healthcare scientists can or should not proceed with a red blood cell transfusion request, especially with regard to patients with with a long-standing or long-term condition and or chronic illness. So the question around this is simply why. In around what is known about again what is known about what is known about the topic or the focus or around the focus. Another point is what renal health is will be a sort of an ongoing issue in an aging population. So so in around this the question and around this as well, what is new? So more data is required to understand and appreciate the renal health in amongst the general population. So in around what are the main what is the main or what is one of the sort of main questions for prospective works around this. So around this, more research or more works is required to help inform whether patients who are suspect for renal insufficiency should be provided alternative forms of therapy or modalities that may, number one, support them in the longer term, and two, identify any particular predispositions before a red blood cell transfusion or RBT is considered, because a number of suspect or renal insufficient patients or recipients who receive long-term transfusions will develop allo and auto antibodies. So in around a another another aspect in around sort of the main questions and sort of contemplations in around what is known about this or what is known in around what is known. So no team should be working in silos, and surely any prospective works or investigations require better integration between laboratory specialists and clinicians. So in around a point around what is new or what is new around this measurement of any RBT or red blood cell transfusion replacement should hold validity and sort of be also so be sort of where one lot of RBT practice or red blood cell transfusion practice in one particular region, one particular laboratory in a region, for example, can be utilized in the same way as any other laboratory any other laboratory in for example in another region in amongst another region, and so in around what are the main questions for prospective works around this across at the same time a cross-sectional investigation may initially be helpful to understand and appreciate how transfusion research practices could be improved with awareness and education medical and clinical teams, especially those supporting the care of patients or recipients with long-standing condition or long-term conditions and or chronic illnesses, and sort of untransfusible sort of patients or recipients, and indeed those and indeed those who refuse, for example, treatment or treatments. So what in around sort of the final one of the final points, um, around sort of the main sort of questions and sort of thoughts or contemplations, um, is in around the what is known about this topic, or this sort of focus. This sort of focus is Scientists need to carefully assess and coordinate in transfusion care, but also endeavor to incorporate evidence-based research to ensure they are not overridden with RBT, red blood cell transfusion requests from clinical or medical teams, thus also ensuring patient safety and quality assurance is at the forefront of practices, thus allowing a prompting sort of the prompting healthcare scientists or healthcare professionals in amongst laboratory medicine to take sort of ownership. So in around what is new, what is in around what is new, in around this. So prospective research should evaluate the role of sort of the basis, sorry, of novel replacement treatments and products in multi-center clinical intervention investigations. And finally, in around one of the sort of in around perspective in around sort of one of the sort of main one of the main sort of questions, sort of another main question or point in around perspective works around this topic, is at the same time is perhaps the identification of phenotypes of different phenotypes, of varying phenotypes and biomarkers may be important to improving outcomes in amongst RBT, red blood cell transfusion, RBT care, and practices and practices. That draws this audio podcast to a close. This has been an audio podcast as part of a Segmental Scruples edition or series. This audio podcast as part of a Rampage Sonar. This audio podcast as part of a Blitz Lobostics, and this audio podcast as part of a Storm Lobostics production.